everyone. My name is Garin Strobl. I am a staff attorney with the Public Health Law Center. So I want to thank you all for joining us today to learn more about who we are and what we do and how we can support you in your SHIP work. Some of you might be new to us, so we wanted to introduce ourselves, and I'm going to turn it over to Julie to start some brief introductions.
Hey everyone, thank you so much for joining us. It's great to see. I see some familiar faces, and then I also see some names and folks that I don't know if I've met before. So it's really nice to have all of you here today. I'm Julie Ralston Aoki. I direct our healthy eating and active living team. I've been with the center for 16 years now. I got my start working on the commercial tobacco team because that's all we had at the time. And then we kind of grew our work and expanded out into the healthy eating and physical activity areas. And so I started doing that, and now here I am. We wanted to tell you a little bit about ourselves as people, as well as kind of what we do professionally. And so I wanted to add that I'm a mom of 3 kids, and I also, I'm half Japanese. My mom's Japanese, so I grew up with a kind of a bicultural household, which really has kind of informed my worldview. And I was really drawn to public health because I really knew I wanted to work on something, work in the interest of social justice and public interest. And this seemed like I have found that public health law has really hit all of those. And so it's just been I feel really lucky to be doing this work. I feel really lucky to have partners like all of you in this work. And so again, thank you for being here, and we're looking forward to talking with you more. So I'm going to ask Safia now to introduce herself.
Hello, everyone. Thanks for joining us for this presentation. I'm Safia Abdinur. I'm a policy analyst with the Healthy Eating Active Living team. I've been with the center for 4 years, in which about a year and a half of that, I've been supporting the SHIP work. And so, and in my as similar to Julie had said, I think my upbringing and my background has really informed a lot of my decisions in pursuing public health as a career, and especially going back to school and getting that MPH. And so I've always been interested in health equity. And as a public health professional, I think doing this work allows me to kind of unravel and bring a lot more awareness to some of the structural and social inequalities that we see in our societies, and being able to contribute and work through policy and law to eliminate those barriers is incredibly fulfilling. I think this whole field is fulfilling to be working with people, and especially since it's rooted in justice and also empathy. So it's also in the service of others and community. So that brings a lot of joy to me and a lot of fulfillment as a career. So so I'll pass it on to Joey to introduce herself.
Thank you, Safia. Hi, I'm Joey Vossen. I'm more recent to the Public Health Law Center. I split my time between, I've just been here about 3 months, and I split my time between the climate justice teams and the HEAL team. Prior to, I'm newer to the Public Health Law Center. I'm not necessarily new to these overall legal and policy issues. I've been a lawyer for about 2 decades, and I also have my master's in urban and regional planning. So I've always kind of worked at that intersection of policy and planning and land use and the law. I am very excited to be starting here at the Public Health Law Center after a career sort of in nonprofit, government, as well as private industry. Part of what is my draw overall to public health is, I know we just kind of finished up Mental Health Awareness Month in May, is I have my oldest child. I have a daughter that is a high needs mental health kiddo, and working with her and kind of navigating the policies and systems and even the environment, as we kind of talk a little bit later about PSE of mental health and how the impacts on physical health. Her journey is one that I will often share with others, as well as what's what motivated me to kind of land a little bit more into this work professionally. And I will now share over to Garin.
All right, thank you. Hello, everyone again. Garin Strobl. As I said, I'm a staff attorney and I have been with the center for almost 2 months. My background is mainly focused on health law. I focused on medical malpractice work, but I also have a municipal law background. And then I spent some time at the Minnesota Department of Commerce leading a consumer protection team. I grew up here in the Twin Cities and I live in, I don't live in Theoworth Park. I live near Theoworth Park, but I feel like I live there because I'm there hiking all the time with my husband. We have 2 young kids and we have a dog, Winnie. And I would say, you know, one of the main reasons I wanted to pursue a career in public health is partially due to my medical malpractice background. I, saw a lot firsthand of how many disparities exist in our healthcare system and how a person's race and ethnicity and their gender and their socioeconomic status can kind of dictate the care that they received, and typically substandard care, and then the outcomes that they would have. So I wanted to pursue a career where I could help make the world a healthier place for everyone. So here I am. So Stephanie, if you could move to the next slide, please. Thank you. So I wanted to take some time to recognize that the center is based in Mitchell-Hamlin School of Law, and that's in St. Paul. And that is Indigenous land in the region of Badote, where the Mississippi and the Minnesota rivers meet. And it's the birthplace of all things for the Dakota people. And so this region has been also home to the Anishinaabe and other Indigenous people from many tribal nations who have who have made and continue to make countless and uncounted contributions to this region through protection and stewardship of the land, air, and water, and preservation and revitalization of Indigenous foodways, and demonstrating resiliency in the face of overwhelming odds. So, we recognize that the land that the Public Health Law Center currently occupies was forcibly stolen, and it comes with a legacy of U.S. law and policy that's aimed at attempted genocide and oppression of Indigenous people, and that this land remains and will continue to be Indigenous land. And so we believe that a fundamental part of our work at the center is to repair and address this legacy and to apply ourselves in supporting the tribal nations in exercising sovereignty and to improve the lives of their community members. So next slide, please, Stephanie. All right, thank you. So as you probably saw in our last slide, we have a lot of people. There's a lot of us here at the Public Health Law Center. I counted 29 attorneys and policy analysts. And then we also rely very heavily on our wonderful research assistants, and we have an amazing internal team as well that keeps the center running smoothly. And the center was founded in 2000, and our main focus at the time really was addressing commercial tobacco addiction, primarily in the unhoused population, incarcerated youths and adults, and then also with people experiencing mental health and substance abuse issues. The center's early work also included supporting healthy food in public places, and we also worked very closely with tribal public health advocates on smoke-free policies and tribal food systems. And fun fact, the center has been a SHIP partner since SHIP's creation. And as you can see, perfect, on this slide. So as you can see from this slide, our work really is founded on the principle that, we want everyone to be healthy. And so we work with a variety of entities, including public health officials, advocates, researchers, community groups, people like you every day to help develop public health laws and policies. And so we focus primarily, obviously, on public health policies that typically really prevent and reduce chronic diseases promote health equity, and we focus really in 4 areas. And the first one I mentioned is supporting communities in developing policies that help community members be free from the harms of commercial tobacco abuse. And then we also help community members have culturally appropriate opportunities to be physically active, as well as helping community members have access to healthy, affordable, and culturally relevant foods. And then finally, we have somewhat of a new focus, and Joey is on that team, as she mentioned. She is part of our climate justice team, and one of their focuses at this point is on indoor environmental health issues such as HUD housing. So with that, I will pass it over to Safia.
Awesome. Thank you, Garin. So for today's webinar, we are going to introduce and maybe reintroduce a Public Health Law Center for folks. And then we'll also do a quick refresher of the PSC training that we did last summer and what PSC means and what does that look like in the context of SHIP work. And then we'll also talk more about our center, the TA services we provide, and how we can support you and your SHIP work. Next slide, please. But before we do that, we're going to take a really quick poll. It's just only about 3 questions. And so we just want to get a better understanding and get more information about who's in the room with us today. And who's familiar with our work. So I see some familiar names and some faces, but I know that we've gotten quite a few new SHIP and local public health staff. So wonderful. Okay, so it looks like we have quite a few new folks. About 37% have been here for about a year or less than a year, 35% about 2 to 6 years, and then about 30% of folks have been here about 7 years or more. Okay. And majority of you have attended our webinar last year. That's wonderful. And for those who couldn't make it, we do have a link that we're going to share later where you can watch the recording. So, and then a good portion of you, almost 60%, have worked with us. That's awesome. Great. Well, thank you so much. And as you can see, go ahead and do that. Thank you so much for responding. That's wonderful to know that many of you are familiar with our work and also attended our webinars. So next slide. Okay, perfect. Thanks, Stephanie. So as you're familiar, as you know, SHIP covers 4 main context areas and 5 settings. And during our presentation, we're going to explore the examples of the different TAs that we provide within these context areas. And we're going to, of course, start with the PSC refresher. The examples are going to walk through like the 3 main context areas in which our staff members within the HEAL team have expertise in, which are MN Eats, MN Moves, and MN Wellbeing. So, and as Garin stated earlier, we do have another team within our center, the Commercial Tobacco Control Program, that supports the MN SHIP work, and which I'm sure many of you are familiar with. And you can find out more information on our website about that work in particular. So we'll provide a link into the chat for that too. So still our examples will cover all of the SHIP 5 settings as well. And so it's just important that, there's going to be a lot of similarities within the PSC change work that we're going to talk about within those context areas, and the different impacts that the PSC change work has for both systems, environment, and policy as well. So next slide, please. Okay, so now we'll get into briefly do a quick overview of the PSC work. So why do policy systems and environments matter for health? As you know, PSC strategies aim to improve the community by focusing on the mechanisms that influence our health and the individual's or community health. So we understand that like focusing on an individual's health is not an individual's health behavior is not enough to make a significant improvement in overall health. So that's why we embrace the PSC change as it takes a more holistic approach. So PSC change work considers the many policies, the systems, and environmental factors that need to be modified in order to improve or prevent, promote, and protect public health. So by addressing the broader aspects, we can implement more effective and lasting measures that really then indeed support that healthier community. So, and just a quick note, so for OSHI office, PSC Works really aims to support and advance that sustainable changes in PSC that will help Minnesota achieve the equitable outcomes that is needed for everybody. Next slide, please. And then so quick refresher. So what is policy and how do we define policy? Policies are those written laws, ordinances, rules, and even practices that people and organizations are expected to follow. And as practices, we define those as like those unwritten policies. And these are often set expectations that people and organizations follow and are enforced through social and cultural norms. So again, I just want to note, so for OSHI work, people and organizations should really work to translate a lot of those practices into written policies as much as they possibly can. So, and next slide, please. And so just a quick overview of examples of policy changes. So some policy changes within PSC change work can range anywhere from like anti-bullying policies in schools as an effort to promote more safe and respectable school environments, or it can even be something as simple as like, an HR policy limiting the availability of sugary drinks and or even requiring the availability of healthy food options in vending machines at work sites. So, and that can go for any of the work settings. So those are just some examples of policy changes. And so now I'll pass it over to Julie to discuss more about system changes.
Thank you, Safia. Yeah, and so just again, we're recapping, so I'll just go quickly through this, but I know that systems is one of those areas that is hardest for people to grasp, including for me, because it seems kind of nebulous. But here's the definition that OSHI and SHIP are using for the systems work. It's processes, procedures, relationships, and power structures in a community organization, the way we do our work or with the way we operate. And I heard Holly Glaubitz talk about it this way, which I think was super helpful, is that systems are one of the mechanisms that can be really useful for implementing policy change. So, you have your policy and then you put your system in place to implement that policy, and vice versa. Sometimes systems change can also lead to policy change. So, while it may be a little bit hard to grasp sometimes, just remember there aren't also bright lines and they're all very well connected. If you go to the next slide, we just had some quick examples for what might be systems change, again, to help people think about what that is and make it more concrete. So an example from the Minnesota Eats context could be that you have a systems change to support a healthy eating policy, so that you set up a system where a manager or someone has regular meetings with the vending machine operator to just make sure that implementation is going all right, that healthy things are being stocked in the machines as required. In the Minnesota Moves context, it could be where a community implements a local engagement plan that includes meeting with community action organizations in the area to discuss the barriers and opportunities to improving access to active transportation and safe opportunities for physical activity, so that community planning decisions will be informed in ways that will make these things more equitably accessible to everyone. And then in the well-being context, a systems example would be that as part of supporting efforts to support mental health in the school setting for students or staff or both, a school district might establish systems to strengthen access to counseling or access to peer support or other related services. So now Joey's going to talk about environment.
Thank you, Julie. So environment is that, while stems from those policy change and system change, and it can be both tangible and intangible. Environment is our settings and spaces within which we operate, people live, work, play, recreate, pray, and worship. And so that is either that built form, it can also be social and economic dynamics as well. Here to the side of the slide, and I apologize if it's a very beautiful example of an environmental change and development. So if it's a little hard to see, we can put the link into the chat so you can go and learn more about this. And what this is an architect's rendering for the Thunder Valley Regenerative Community Development. It's an initiative to create community, homes, business, and rec space to reflect the values of and the culture of the Lakota community on Pine Ridge. And the initiative here is to create that healthy, innovative, and culturally appropriate built environment. And I think even kind of saw in the chat, folks kind of being drawn to public health and that work as we are as a community, addressing public health and culturally appropriate and regenerative frameworks. So, but we'll put in the chat, if we haven't already, a link to this example as well. We can go to the next slide. And then examples of environmental change within the SHIP program areas. So Minnesota Eats, that's where, you know, our healthy food and beverage options are going to be predominant, easily accessible. And so it's that, as Julie was talking about, like that system change of vending machines. You know, what are folks seeing? How is that physical environment changing with putting predominantly healthy choices in our environment? Minnesota Moves, you know, that can be work site, school site, designating spaces for physical activity breaks and mindfulness breaks for employees. And I think a lot of us who might have kids in the school system see how their environment looks different from maybe when we went to school with that, you know, body movement throughout the day. And then Minnesota Wellbeing. Hospitals and clinics create welcoming environment with signs in different languages for all patients, employees, visitors, especially in our medical framework and communities and health settings. We are seeing like the environmental impact of that space, and if sort of that level setting of this is a space for healing, this is a space for well-being, and being seen with different, you know, signs in different languages, wayfinding, so that it's accessible.
Yeah. And so, you know, the bottom line again is, and again, some of you will know this already, like the back of your hand, but you know, all of these things work together. You can't think about them in isolation. They really go in tandem. And sometimes the lines are blurry, as I said, but, you know, again, a good way to think about it is that the policy can provide a foundation, and the systems and the environmental change then make that policy operational, make it real, make it concrete. And this diagram here and these points are kind of an example of, you know, like a healthy food shelf kind of environment or situation, and how policy systems and environment play out in that. So like, say, you know, your food shelf is connecting with those local farmers, trying to get more fresh produce and at a low cost into the food shelf environment so that people have access to it, and then talking with their clients to identify what types of things people will find most useful or will want to use, and also maybe things that they may need to learn more about, so to be useful to them. And so then the environment changes within that food shelf because those things are available, and there's ways, techniques like signs and so forth, like the super shelf strategies, to help elevate awareness about those offerings and, you know, their connection to health. And then all of that is kind of supported or bolstered by having a policy that sets some guidelines about the foods, the types of foods that the food shelf will accept, and how they will display them, and that kind of thing. So, you know, this is just a simple construct to kind of illustrate how these things all go together. And you know, I saw that, next slide, please, Stephanie. I saw that many of you, probably the majority, did see these webinars that we did last summer that came out of the collaborative work we did with MDH SHIP staff, as well as several local public health partners, to do some of these definitions and level setting on public health, on PSE work for SHIP. And so these are the links to those webinars from last summer if you haven't seen them. So please check them out. Now, next, we're going to turn to the topic of legal technical assistance, why, you know, the main topic for the day, about why you're here and how we can work together. So I know that you have heard the phrase technical assistance in many, many times and contexts, But I thought it would be good just to take a moment to talk about what it means for us at the Public Health Law Center. And so on the screen, you see in the types of legal technical assistance we provide. So it's like legal research, it's help with policy development, policy implementation questions, and sometimes policy defense, because public health policies can be, or laws might be challenged. We also do publications on themes. When we're getting a lot of questions about something, we may decide, okay, that'd be useful to have a publication about it. And we do trainings like this one, or trainings on policy development. What we don't do, what legal TA is not for us, is not direct representation. We don't take clients, and we don't lobby. And we have this resource on our website. The link is there about what is legal technical assistance. So if you wanted to kind of look at that more, please feel free to check that out. But in addition to sort of these broad categories of things, I wanted to tell you about some of the specific things that we are tasked to do as part of our SHIP work that I thought it would be helpful for you to be aware of. So in the Minnesota Eats context, one thing we're working on specifically is identifying PSE examples to support produce prescription programs, focusing on those programs that involve retailers like grocery stores. For the Minnesota Moves context, we are identifying some inspiring and promising examples of how communities are engaging in park planning to improve equitable access to parks. And then in the Minnesota Wellbeing, we're collecting examples of policies that are relevant to trauma-informed work sites and healthcare settings. Now, my colleagues here are going to talk more about each of these ones in depth here in a moment, but I also wanted to just share with you that in addition to those kind of major topic areas, we're also working on some other kind of miscellaneous but also important things, like updating our fact sheet on legal protections for breastfeeding workers, because as many of you probably know, the federal law recently changed again, Minnesota law too, for the better. And so we're excited to be able to do that update. We also do have and will and do review policies and provide technical assistance on policy development for things like worksite breastfeeding policies, or reviewing zoning codes with a health equity lens, or healthy foods and health food shelves policies, or researching policies to support to increase healthy beverage consumption, and many other topics. We also do presentations on centering equity in policy development. We've been doing that for some tribal SHIP partners and for other partners. We're probably going to be doing something similar like that maybe at the fall SHIP meeting. We also have gotten some questions about, say, like, what's the difference between lobbying and advocacy? And I've been talking with MDH SHIP staff about maybe putting together something about that, because we know that's a question that comes up a lot and is kind of a confusing area. And so we also provide this kind of like specific tailored technical assistance on the strategies that are, or the strategies that are related to the SHIP PSE work. So to help you navigate a little bit, we have put together a list of our SHIP related resources to help you make them easier to find and identify for you. Stephanie will put that link in the chat if she hasn't done it already. And we will also be working on posting those resources in the relevant places in Basecamp. So now I'm going to turn it over to my colleagues who are going to give you a deeper look at some of the specific areas we'll be covering, and then I'll talk to you some more about how you can access our TA services. Julie.
Thank you, Julie. Thank you. I really appreciate, like, again, kind of talking about that level setting about like what TA is and what, how it translates into the SHIP work. So I mentioned in my introduction that I have a background, like a couple decades as a lawyer, and then also a background in urban regional planning. So what I'm doing right now in the work with Minnesota Moves, a TA example, is looking at park planning, and specifically park and open space planning that elevates opportunities for equal access to movement, community connection, and green space. One of the key ways that we're looking at this is addressing at the forefront access. Who has access to the parks? Does the park feel that it is accessible from different experiences, different genders, different backgrounds, different parts of the community? How do folks get to green space in terms of accessing it through transportation corridors, greenways? Also, in terms of considering access, we're looking at different levels of affordability and acceptability. Is this a green space that you need equipment? Is that equipment, is it accessible? Or, is this space that is well lit? Are folks, is this space that is culturally appropriate with wayfinding and also the experience? So we're looking at, a lot of different issues here, the more so in terms of green space, park space, and that equity lens, that equally accessible lens across different community members. And that's going to be different based on the community. So having that conversation and being able to engage with the community in a way that also moves forward development of park and open space. And next was Minnesota Eats.
Thanks, Joey. Yeah, so for the Minnesota Eats TA, one current example we're providing right now is in the context of the prescription produce program, so also known as VeggieRx. So we know this is an area where a lot of you work in, and so as TA providers, we're currently researching to identify examples of PSE approaches that will support the efforts for communities to implementing this healthy food prescription program in the urban, rural context, and that's examples throughout the country too. So we're in the works of developing a resource with curated examples, specifically examples of policy that focuses on retailer redemption options. So we hope that the resource will cover the different types of retailers, such as Cup Foods and Target, and how they set up their contracts and just the entire process of redeeming within the context of those types of retailers and all of the operational processes that go into this. So I think there's an area where, there's a lot of and compared to some of the farmers market produce programs, there's a lot of unknowns in terms of the retailers' policies, but we hope that our resources will be able to cover the different examples of policy throughout the country and provide those steps and procedures and implementation to support your work. So that's one example from the VeggieRx, and I'll pass it to Garin to talk about the breastfeeding.
Thank you. So as Julie mentioned, I am working on the breastfeeding fact sheet. And as you hopefully know, I hope you've heard of the PUMP Act. That is some new federal legislation that pertains to workplace protections related to breastfeeding in the workplace. Minnesota also recently in this legislative session, we just amended our corresponding statute related to that. And I'm happy to say that it is even stronger than the federal laws. And so that is awesome. And Minnesota, I mean, I could talk about this for hours, but Minnesota really has some great, robust laws around nursing in public and just nursing protections for mothers who are incarcerated. Also just pregnancy related accommodations. And I'm sure you heard too that, the paid leave, and that's something that will be happening. So anyway, we live in a really great place. And, but I have been spending time just pulling all of those laws and kind of putting it together in a fact sheet just with questions about, how long does this protection, how long am I protected, under state or federal law, or, can I take breaks? Is it only a certain amount of breaks? But it really kind of dives down into those smaller issues. And so we're hoping it's helpful for people and a great resource. So it's been a great project to work on, and that will be up on our website very soon. And then if we can move to the next slide. So I am also working on a project for the well-being focus, and part of that, so Safia and I are working on together, as well as one of our wonderful research assistants, Emma, and we are really diving into trauma-informed policies. And what that is, for those of you who might not be familiar with that concept, is that it's essentially the idea that, most of us unfortunately experience some kind of trauma throughout our lives, and that trauma can affect the way that we operate and function in our work, in our personal lives. And so being trauma informed, and the goal with that, either in workplaces or just individually, is that people first become aware that people have these backgrounds and experiences that affect them every single day, and that you're sensitive to that fact, and you're able to kind of focus your interactions with people in a way that's empathetic to that idea and that person's history that you may not know or understand, and doing so in a way that eliminates anything that's triggering, or that could trigger some of those experiences and kind of hinder the way that person either works or just goes on in their daily lives. And so we have been working to look at the different trauma-informed policies, particularly to play at in the workplace, with the goal of just looking at what different organizations are doing across the country, in order to really create, just a safe and inclusive and empowering workplaces. So I'm excited about that work and excited to see what we can find, and hopefully help you learn more about it as well. So I think we'll turn it over then to Julie for the next slide. Perfect.
Yeah, thank you. Thank you. I was just gonna, Pa, thank you for that question about urban ag. Yes, we have many resources about that. And I was just gonna try to put something in the chat, but I have to talk now. So, but there are that guide, that index or list has several things listed on it. There's a community garden policy guide. There's also, we worked with a project with the Rudd Center and the Center for Agriculture and Food Systems. Just finished that up last year, and we worked on things like there's a resource about like growing food where you live and sort of the issues to think through, policy issues to think through there. So lots of things, and I'll try to get those in the chat in a minute. But okay, going to how do you get a hold of us for technical assistance? So whether you have you know what you need, or you're just kind of exploring some ideas, we encourage you please to reach out. The earlier the better. Even, it may be that we have an initial conversation and it's like, well, let's kind of each go back and maybe do some more thinking, and that's it. Or it may turn out into we might do some legal research for you or something else. But how it basically starts, it's pretty easy, is like you can reach out to your community specialist. I believe this is Alice, Chelsea, or Anna and Jenny, depends on your area, but reach out to them and they can put you in touch with us. Or you can also email us directly. That's our kind of generic email address. And on the last slide here in this slide deck, we also have all our individual email addresses. But please also loop in your community specialists, because we want to keep them in the loop too on things. But that's an easy way to contact us. Thank you, Stephanie, for that preview of that. But then if you could go back to the other slide, please. Then we'll start the conversation. And what we typically do is kind of have what you might think of as an intake meeting, where we just do a phone call or a Zoom meeting where we just talk out, make sure we understand what you're asking for, what your needs are, maybe have a conversation to flesh that out. And then we can follow up with, maybe it's just another phone call or a Zoom meeting. Maybe it's an email with some information, some links, and then, or maybe it's a full-blown memo where we're kind of outlining some legal issues that might be relevant to the issue you're working on, or identifying policy options. Like we often can look at other jurisdictions, whether they're in Minnesota or other states, to give you examples of how communities are doing the kind of thing that you are trying to do. And then sometimes it may be that some kind of a training or some kind of a presentation might be helpful. I know we've heard from folks that sometimes, we have that patina of being part of a law school and sort of being seen as a sort of a third party. And so when we go in to talk to groups, they see us as having a sort of a different voice. We can kind of bring a different perspective to the conversation that can often be helpful in moving things along. In terms of where we can provide, John Franco, thank you for your question. I'm not sure if you're asking where we can provide TA. is just to places in Minnesota, or is the stuff we do just about Minnesota? So I'm going to try to answer both of those questions. For the SHIP work, of course, this is supporting Minnesota SHIP work. And so as a SHIP partner or a SHIP grantee, we can help you with SHIP related work. We also, depending on your need, like, so our commercial tobacco team also has a national program. They have a program in California. They have a program in New York. So they provide technical assistance basically all over for things all over the country, and in those specific states in a very deep way. For us on the healthy eating and active living team, it's a little bit more topic specific. So like if you have a question about that, we should talk. One thing I also want to make sure to mention is that we do also support the tribal SHIP work. We work with the American Indian Cancer Foundation and the other tribal SHIP providers to sort of support and, provide when they need some legal research or help with policy training, something like that. We are very glad to assist with that. And we also work with some tribes in other parts of the country, or the Great Lakes Intertribal Epicenter on things. And so that's kind of another area where we do work both in Minnesota and outside of Minnesota. And I have this quote up here. This several years ago, we were really pleased to receive this kind of feedback from some of our out-of-state partners. And it said, her feedback was like, "You all are too accessible as lawyers." And of course, we're not all just lawyers, but I think that the sentiment is that, for people aren't used to a legal center, I think, trying to work so hard to help people to get to yes and to problem solve. People often see lawyers or policy analysts as people who maybe roadblocks instead. And so we're really pleased to have that reputation. And we just want you to know that we are here to help. And we want to be practical and we want to be accessible to you. We know that every community has its own dynamics, its own priorities. And we know that as a technical assistance provider, there's a lot that we don't know about the context you're working in. So we approach our work as we are bringing you tools and we are bringing you ideas and support to help further the goals and priorities that you have already identified, that you and your community partners have identified. We're not here to set an agenda or to tell you what to do, but we're just here to help you get to where you want to go. And so I hope that that's the main thing we wanted you to take away from this presentation today. And so with that, we just kind of want to open it up if there are any more questions. And Gianfranco, hopefully I'm saying your name correctly, I don't know, but if you want to clarify what your question is, or if I can say more about that, I'd be very happy to do that.
Yeah, my question was about, I think you can answer it. It was, for example, looking at jurisdictions outside Minnesota, like, New York, California, and Garin, they're doing great work in other places outside Minnesota. So, yes,
yeah.
If we could get your help to try to move some of the work to our community.
Sure. Yes, absolutely. And, and often, like, we do try to find, in terms of looking for examples of things, obviously sometimes for some communities in Minnesota, another Minnesota community example might be really helpful, but for others, looking for examples like at other states, whether it's another Midwestern state or a state somewhere else, in a totally different part of the country. So we can look at all of that. This reminds me that I wanted to mention, we also we are expanding our work in other social determinants of health areas, like the health well-being work is one really great example of that. But just recently, we released several resources talking about how states have expanded access to healthcare, low-cost, affordable healthcare, Medicaid-like healthcare to people who are undocumented. And of course, Minnesota also just passed a law that will be doing that, just super exciting. But we do that kind of work. That was not SHIP-related work. That was work with another partner here in Minnesota. But we also have other kinds of resources like that are maybe not food or physical activity specific, that are maybe more focused more broadly on health equity, but that's also on our website. Karen, I see your hand is up. Please.
Yes, I have two questions. The first one, really relates to when we first started. I've been with SHIP since pretty much the beginning. It
Yeah.
seemed like when we would access the Public Health Law Center, the work would come out of our budget. So I want to be aware, or and it's maybe because I've been here too long, maybe it's not anymore coming out of our budget, but coming out of the SHIP budget, housed at whatever, the state. So I wonder if we have to be careful about asking for too many things. For instance, like let's say we're trying to pass policies around something. Is it okay for us to turn to you every time an organization wants to pass a policy? They share it with us, we send it to you, you look at it and say yes or no. So I want to know, I'm trying to figure out where the lines are not blurred, because in my mind, they're a little bit blurred. And then the second question is around just something that's come up recently around energy drinks in our area. And I think I understand that you were working on some of that. And I don't always need a policy, but I might need a procedure, like a handbook procedure. So those are two sort of completely different questions. And thank you.
Yeah. So to your first question, and thank you so much for that, Karen, because that's a really great question. So and I'll just be as blunt about it or clear as I can. So we have a contract, with the MDH to provide technical assistance, and that contract includes those specific the park planning, the produce prescription stuff work, and the Minnesota Wellbeing, the policy identification and examples work. And then there's respond to technical assistance requests. So in a way, the answer to your question is it kind of depends on how busy we are and how much capacity we have at the time. In terms of providing that more tailored, sort of specific, individualized, policy review and so forth. But I would say right now, based on how things are going, and I would invite any of the SHIP staff, I know there's several OSHI SHIP staff here are on, please feel free to jump into, and if you want to correct or clarify anything I'm saying, I invite you to do that. It's kind of like if you, first come, first served in a way. If you send us something, you've got something that you want us to take a look at, send it along and we can let you know. Oh, right now we can let you know, oh, right now we're super busy, but maybe in 4 weeks we could get to it, or yes, maybe right now we could do it. So it really kind of depends, and it doesn't come out of your budget for this kind of TA. Now there might be, if there's some long-term project where it goes super in depth, really focused on, your SHIP area, that might need a conversation with the SHIP OSHI folks about that. There have been times where we've been asked to go more in depth on some things, and sometimes that has meant needing a separate funding arrangement for that. But I think, it just kind of, it's very contextual. I don't know, Brian, I saw you came off on screen. I don't know if you want to add anything or if anybody else does.
I actually was just going to add a question. Have we ever had an issue with that? There's been so many SHIP requests that we would need extra funding. Not recently. I think the last time maybe something like that came up was we did, this is also an urban ag related example. We did a scan of the Dakota County laws and the laws in 11 cities in Dakota County to look at all the ways that their laws might impact access to healthy food. Mm-hmm. And so that was a pretty big project, right? 11 cities plus the county. And so there was a separate contract to support that work. Okay. Yeah. So overall, not an issue unless we just,
Yeah. Exactly. Yeah. So, and we would love to be, I think it would be great to have the problem of oh my gosh, we have so many TA requests that we can't get to them all. So that hasn't happened yet. And then Karen, does that answer your question on the funding piece and how that works?
It does.
Okay. And
Oh, go ahead.
No, I was coughing. Go ahead. You go.
Okay, and then for the energy drink question, I guess I've been starting to hear a little bit about that coming up. We actually raised it in a meeting with Sadie and Hillary a couple of weeks ago, and I think that is something that we have done work around sugary drinks, and of course, many energy drinks are also a sugary drink. But if you are interested in getting some, some more ideas, maybe it's like you said, maybe it's not policies, maybe it's systems. I would love to. We can talk with you more about the context of what you're talking about. Like I imagine it might be schools, but if there's another context, we should talk about that. Does that answer help with the energy drink question?
It does. And you'll see that Carolyn McCourt also, I think it was directly to me, but I know that she it is with schools. And I have a particular principal that thinks that all of his behavior problems at his school are directly related to that. So he wants to put something in place. And we got an example from Bagley, but that's the only example we got when I put it out on Basecamp. So of a handbook that said no sugary drinks allowed.
Okay. Okay. Yeah, it's hard to say, Carolyn, on your question. I'm not sure. I think I'm seeing increasing some research coming out more and more about that caffeine is not good. For young people, but whether they'd be able to, the last update to the smart snacks, as people who are working in this area probably remember, that was a heavy lift. I'm not sure. It's hard to say whether they will be updated or not. I wish I knew. The training about education and lobbying. So, that we haven't done that training yet. We were hearing that. I've been hearing some inquiries about that. I did put some information together about that for someone. So I think we'll probably maybe talking with Brian more about putting a training on that together for SHIP partners down the road.
Yeah, Susan, I'll loop you in with that too.
And Karen too. I think I'm the one that started that one too.
I wasn't gonna say, but yes, thank you for.
You can throw me under the bus anytime you want.
Well, Karen is an example. Karen and I have been in the ring together for a long time, so it's great to have partners like you, Karen.
Thank you, and I would say the same to you.
All right, any other question? You got us all here right now. Are there any TA questions?
Do you maybe talk a little more about how, with the commercial tobacco work, how you can support policy change?
Sure.
There's a lot of new SHIP people, so that's one like very tangible thing I think around policy.
Yeah. So we have our commercial tobacco team is actually quite large, and there is within that team a team that's specifically devoted to Minnesota commercial tobacco work. Rachel Callanan is the team lead for that team, so she would be the best person to reach out to. If somebody could put her email maybe in the chat, that would be great. And Stephanie just put a link to our web page devoted to Minnesota commercial tobacco issues. And so so that team is available to do all the same kinds of technical assistance that we are, but focused on commercial tobacco work. I know a big area, of course, has been vaping, and dealing with e-cigarettes has been a long time. That's been a big project. Also talking about dealing with flavored products in particular, although the federal laws changed there too, which is great. But I also know that a big part of their work has been thinking about from the equity perspective of enforcement issues and how to have good tobacco control laws, commercial tobacco control laws that don't add to the harm for kids, particularly from marginalized communities. So really thinking hard about how we treat particularly underage users, because they're if we acknowledge or recognize that they are been targeted by an industry that's been intent on hooking them on a highly addictive product, you want to treat them accordingly with that kind of empathy and support rather than just fines and jail time. So that's been a big part of their work. They do they are very available to again review policy language or to help think through hard policy questions. Sometimes how do you make the case? Like if you are looking at if you want to update your licensing ordinance and you want to look at that enforcement scheme, how do you talk about that with your community, your coalition members or other folks? They are available to assist with that. Because we do so much commercial tobacco work all around the country, we are really the leading a technical assistance provider in this area, and so very up to date on new developments in policy and just on what's happening around the country in that area. Okay, I'm just trying to read your comment here, Brian. Okay, Minnesota breathes. Okay. Thank you. That's helpful. Did that answer your question, Brian, or do you want me to say, is there anything more I could say about that?
That was a great overview. Any other follow-up questions from any attendee on that?
Yeah, so I would just say, as came out with Karen's question, we are free to use. So, utilize us, whether it's on a commercial MN Breeze or at whatever context it is area. We are here to help you, and and sometimes we may not be able to, but we will tell you that and let you know, and we will also try to help you find then the right resource as your community specialist, and other folks at SHIP will also do so. But please don't forget about us, because I do feel like sometimes I've heard that people with COVID and everything, we've and so much change too, and all of our work, that people sometimes have forgotten that we are here as a resource. And we really enjoy this work. We want to be partners with you, and we know you're doing really important and valuable work, and we are excited to be part of it. Oh, I realize we're at time. Oh my goodness, the hour went by so fast. Okay, so I guess, yes, thank you, Brian. We will be sharing the slide deck out. Maybe we can talk to you about what's the best way to do it, or we can send it out through Basecamp, however you think. But thank you, everybody, for the time today. Thank you so much, and we hope we'll be hearing from you soon. Thank you. An evaluation link will be coming out afterwards, so please fill that out and let us know if there's anything we can do to improve. Thank you.